There we are. All right. Welcome, everybody. Today we are talking with Dr. Jawad Mustafa, and he is an OBGYN with an expertise in breast cancer. He has been a family physician for 17 years and has transitioned into this specialty. And we're really grateful to have him here today because this concerns a lot of women and a lot of people. And we're really glad that he has taken the time out of his day to come talk with us. Thank you so much.
Most welcome. Most welcome.
So can you tell us about your background, where you grew up and how you decided to become a physician and the shift into what you do now?
Basically, I'm from Pakistan. I'm Dr. Jawad Mustafa. I've been practicing for over 17 years. I graduated in 2004 from medical school. And after that, I've been practicing as a family physician. I have in my own clinical setup, which is a family setup that my family has. So in 2012, I did my MPhil in obstetrical and gynecological ultrasound. So I've been providing diagnostic ultrasound facility in general for abdominal and gynecological and obstetrical, you can say, cases. But for this particularly breast health and cancer awareness campaign and this dedicated facility that I'm providing for breast cancer screening ultrasound, this is for over 2 years as a dedicated, you can say, service that I provide, especially for those who are not able to afford a regular screening ultrasound. So I'm giving them a low cost facility. Along with, I have designed and developed a whole dedicated website which has all the information regarding breast health, breast cancer, and my organization, it is a non-funded organization, so I'm managing it. I'm running all this setup just to create awareness, and for over a year this organization setup is working.
Sounds like you've really dedicated a lot of your life to this, running a whole website, and that's a lot of work to do that with no funding and no outside help.
Well, basically it is a requirement of the day, requirement of the time, because if we are not taking any initiative, then we are at 0 point. We are just talking about it and not doing anything, so it will not do any good to any person. So it is not just a problem of any particular race or any particular country. It is a global process, global thing that is happening and increasing day by day. So we have all to be proactive about it, whether men or women. It concerns us all.
And how did you decide to get into this then? Shifting from just family physician, what drew you to it?
Basically, I've been doing diagnostic ultrasound for over 15 years, but this particular thing, there is a lot of gap that I recognize, that there is a gap between the information provided, the patients, and that they are not able to properly get the idea and the concept of screening in this part of the country and even globally. Mostly the screening process is above the age of 40 years, but the risk factors, they are starting right from the teenagers.
Really?
So this whole, definitely, the diet we consume, the items we wear, the skin products we use, the thing we inhale, everything contains all the carcinogens, all the chemicals that are affecting our daily life and our digestive system, our hormones and everything. So the risk factors are starting from the teenage, even before that, and the screening is above the age of 40 years. In all these time, I have been getting a lot of patients, especially in the late teens and 20s, with breast lumps, breast problems, infections and all that. But all of them, they were told that nothing happens in your teenage and 20s and 30s, because the breast cancer happens above the age of 40 or 45 years. So whatever happens, you don't have to worry, just wait for it, it will settle on its own. And many patients I have seen in their 20s reporting with breast cancer just cause they ignored all the symptoms. Their physicians, their treating gynecologists, they didn't listen to their complaints. They just told them to, don't worry, if this is a small lump, it will go away on its own, and even if it doesn't, it is not cancer, because cancer doesn't happen in their 20s. So there were cases that I did scanning and I forwarded them for the biopsy, and it turned out to be malignant.
Oh,
So
wow.
it made me realize that there is a lot of gap and it requires a lot of work to do. So on my
Yeah,
end, I started this.
that's what I've always heard is, oh, it's not a risk until you're older. I'm really surprised about that.
There are studies and research about this, and there are even published studies that the
Hmm.
risk of getting breast cancer in 20s and 30s, it is on the rise,
Yeah.
particularly due to this factor that nobody is talking about it, nobody is screening it, and nobody is even ready to diagnose it, because they all say that these problems, these lumps or these things, they happen in their teens and 20s, but they are never
Mhm.
cancerous. They are cancerous. So that's the whole point I'm trying to make.
So it sounds like maybe there are some outdated ideas in the medical profession that they're just not even looking at it as if it could possibly be cancerous just because of the person's age.
Actually, there are two things, two main concepts, two main things. One is medical science is definitely looking at all these cases, the data is being collected, but to avoid the panic, because whenever you report a thing that a girl of 22 years or 23 years of age got diagnosed with cancer, in that area, in that whole city or all that locality where that study is published and it is being recognized and being taught to their you can say students and doctors, it will definitely create a buzz. But
Really?
to avoid the undue stress, undue panic, all this data is being collected, but these case reporting are being studied in those countries where research facilities is there. In the less developed countries like Pakistan, India, Bangladesh, Philippines, in the UAE, those system is there, but still it is not of that you can say organized system. So all these countries, the data is not even collected, and even if it is collected, it is not being scrutinized and published the way it is in the US or the UK and all that. And the second thing is, it is very hard for the healthcare system to provide healthcare facility to every person that is coming to the clinic or the hospital, because if
Mhm.
they start to screen 20s and 30s year females with the ultrasound and the biopsies and all that, it is already flooded, it is already totally choked system, healthcare system everywhere. So that's why they are saving their own time, they are saving their own cost, but the cases are on the rise. And particularly in this post-epidemic era, these 4 or 5 years, it has exposed all the healthcare system everywhere, because we can deal with the normal disease process that is happening over a trajectory which is predicted, but any additional burden, no healthcare system can sustain it. So that's why it is very hard to add another chunk of patients or probable patients to this. So it is on both ends that government is not able to fund all these additional cost and all this. So that's why self-care is the main thing, the only thing that any person can do, self-awareness and self-care. This is the thing I've been trying to educate and guide every person, every female particularly, even in their teens, early teens, they should start learning it so that they can have a better life and a reduced rate of disease and cancer in their 40s and 50s.
Um, that's exactly the kind of thing that I had so many questions pop into my mind while you were talking, but that's one of them is that's exactly the kind of thing that I think um, that I want to promote here is that people take responsibility for their own health and also to, like you said, you can't, it's wonderful that we have doctors, but also they can't be everywhere at once and they shouldn't have to be. You know, we should try to take responsibility for what's going on in our bodies as much as is possible. You can't always, affect things, but um, I wanted to get into first off, you were saying that these cases are on the rise, and I'm wondering, and you were talking about some of the risk factors and some of the substances. As I was doing some research earlier, I came across a list of a lot of different risk factors, whether environmental or hereditary, plus just a lot of questions that people have about breast cancer in general. Could we start with just talking about what breast cancer is, and then not specifically the types, but just like what it is and then maybe get into some of the risk factors that contribute toward it. Because there were some things I learned today that I had no idea and were really surprising, actually.
Like any cancer in the body, cancer cells are basically those cells which are not under any control of the body system. Body mechanism has its own system of cell growth, cell division, and multiplication, and cell death. The program cell death and all that, this is all under the control of different chemicals, hormones, and under the influence of brain and all that. But if
Wow.
a collection of cells, even a single cell or a collection of cells, that is not following this pattern of growth, division, and programmed cell death, then it is definitely a mutated cell or with a
Okay.
cell having a damaged DNA.
Okay.
Any trigger, any process, any hormone that is facilitating rapid growth or rapid division of cells, even if it is a normal kind of cell, it is on a high pace of growth and division. But due to all this process, this speedy process of growth, division, and multiplication, there is a chance that there are damaged cells also produced, because in a hurry anything can go wrong. The same way, any cell growth process, it can go wrong if it is under any kind of stress, any inflammation, any stress of carcinogens, any stress of radiation, any stress of those chemicals that are either ingested or applied on the skin or all that. So these chemicals, these triggers, they trigger the formation of those cells, damaged cells and damaged DNA cells, which then, if increase in their size and number, they lead a form of cancer. Not all lumps are cancerous. The main thing is those cells may or may not have the potential to invade and grow beyond their own, you can say, premises. So there are kind of lumps which are non-cancerous, like a lipoma. It is a collection of fatty cells that is confined, that it will not spread, it will remain in its own place. It can grow in size, but it will not invade the surrounding area. So these all are the kind of tumors which are not cancerous. The cancer cells, on the other side, they will increase in their number and size, and they will not care about their original boundary. They will
Yeah.
invade anything and everything that comes in their way. Either it is a bone, it is muscle, skin. They will invade everything because they are just in a hurry to grow the number and size and eat everything, any resource, energy source that we put inside. So same thing happens in the breast cancer thing, that there are different kind of cancers. It can be cancer that is more prominent in the skin, it can be in their glands, it can be in the ducts, it can be in the lymph nodes of the armpit. So anything that is happening inside the breast tissue or the nipple area or the armpit area, it if it is not in any control of the body system, and if the body is not able to neutralize the threat, then definitely it will grow, it will increase in number and size. And depending on the original health state of the patient, the immunity of the patient, and the nutrition and hormonal balance of the patient, its division and its growth, it varies. It can multiply within a span of weeks or months, or it can take up to years if the body is able to partly control or manage the situation.
Okay. That's a really good explanation. I've never heard it explained that way before. Do the cells expand their own territory, or do they? Because I know you said when the DNA of the cell is damaged, right? Does it spread the damage to surrounding cells, or does it expand its own, create new cells, copies of itself that grow the cancer? Do you know what I mean? Does it actually actively go and find new cells to destroy, or does it create its own copies?
Actually, as I mentioned earlier, it depends on the other factors that are happening at that time. Because
Okay.
if the radiation exposure is more than once, let's suppose a person is living in a place where there is radiation exposure, or there
Right.
is a workplace where he or she visits, where there is radiation exposure to overall body or any part of the body. So these radiation exposures, these carcinogens or any chemicals which are increasing the pace of the multiplication of the cells.
Okay.
It has both kind of effect. Let's suppose a cell is damaged, it is growing, it is multiplying. That damaged cell will never produce a healthy cell. It will produce a copy of its own, whether it is of the same damage or even worse damage. So it all depends on the factors that are influencing the growth of that cell. In the case of the breast cancer, mostly it is under the influence of estrogen hormone. So if the estrogen hormone is normal in amount and its effect is normal on the breast glands and other part, it will have a different kind of cell growth and mutation than a person in which there is estrogen dominance. If a person is having excessive number of estrogen along with added external estrogen like chemicals that she is putting either on the skin or she is ingesting and all that. So these added bundled effect of the internal and external estrogen on that damaged cell, it will cause excessive number of cells to grow, excessive number of cells to increase in their size, and the pace at which they are multiplying and increasing, it will go 2 or 3 folds. So it all depends on the factors that are influencing the growth. Along with, if a person is eating a lot of sugars, this sugar is a direct energy source for those multiplying cells. The amount and the rate will increase drastically if that person is not conscious about the diet. So these contributing factors, they all contribute.
I wanted to ask you about the estrogen. I was learning about that as well. And I have actually taken tests before to see, about which hormones are dominant or things like that. But I'm wondering if you had someone come into your clinic or if you were just advising somebody at home, how would you let them, what would you advise them to do to find out if they're estrogen or progesterone dominant or balanced or etc.? Because that estrogen increases the risk of cancer, of breast cancer specifically. So how would you discover if you're estrogen dominant?
There are a few signs and symptoms that can give an idea to any person, whether a person is sitting in the home or visiting a clinic, any female. There are
Okay.
certain signs and symptoms that can give a clue that something is going on, especially with the hormones and estrogen in particular. Like in the skin, if there is stubborn acne, if there is you can say repeated pain and tenderness in the breast, heaviness in the breast, if the breast feel firmer and nodular, spongy like, it is
Okay.
a sign. And if there is weight gain, recent weight gains, particularly on the lower tummy, on the hips and thighs, if there is a sudden breast growth, if there is hair fall, if there is irritability, brain fog, if there is increased craving for carbs, uh, heavy periods, or increasing menstrual cramps, these are all signs and symptoms that can give a clue that there is something going on.
So I have
So
heard that um, stress leads to estrogen dominance. Is that correct?
stress,
Or it
stress,
can?
it can, it has an associated effect, like any stress, every person is in stress at the moment,
Yeah.
every person, due to daily routine, their daily lifestyle, the work routine.
Yeah.
If a person is driving, he is under stress or she is under stress.
Yeah.
The moment she enters in the comfort zone in the home or office or anything like that, where she is sitting comfortable, she is supposed to be in the normal state of mind. But if a person is not able to feel relaxed or not able to ignore all the things that were happening a month ago or year ago or day ago, this added stress, it increased the number of those hormones which are stress hormones in the body, like the adrenaline rush will be there will be increased cortisol if she is not sleeping properly. So these disturbed hormones, they will suppress the normal hormones in the body which work or act for normal cell functioning, like the estrogens, the progesterones, the growth hormone, thyroid hormone. So any added thing that is causing any kind of emergency situation, panic situation in the body, it will suppress the normal functioning of the body. Same case is if there is estrogen excess in the body, whether due to increased production of the estrogen, or she is taking those chemicals which act as external estrogen in the body. So if she is having those kind of things going on, then definitely she will feel all those signs and symptoms that I already mentioned. So stress has an effect directly. It may not have any kind of direct effect, but it is a contributing factor towards those things, those processes which are causing breast damage.
So stress, I know if you're not sleeping enough, you can get stressed, and also, I can't remember what the name is of the hormone that suppresses appetite, but also there's less of that, so then you're craving, carbs. So it sounds like all of that could kind of mush together into a really bad recipe for increasing your chance of breast cancer.
Actually, that's the whole thing. The concept of breast examination is something that was initially used to describe any process to check breasts, whether it is self breast examination or clinical examination. But ideally, it should be breast awareness, and
Okay.
it should incorporate all the medical and holistic aspects to it. It is not just about checking your hormones or checking if there is a lump in the breast and all that. It should include any person, because every person is different. Every person has a different lifestyle, different routine, different sleep time, different pattern to channelize the energy and all that. So everybody needs to learn what is normal for her, what is
Yeah.
a good thing for her in her own lifestyle, in her own age group, and in her own living, you can say, living type and all that. Because
Okay.
he has to learn which diet is good for her body, which uh, sleep pattern, sleep time is required, which things are harmful, what she can apply on the skin and the body on a regular basis, and which aspects or things to avoid. So all these factors she has to learn on her own using the help of the Google Doc in general, but particularly any healthcare professional who is dedicated towards breast health or obstetrical and gynecological health. So it requires a process of developing and training doctors, healthcare professionals, any person who has all these aspects covered, who can guide and educate others, because this is a requirement of this era to have those dedicated professionals as well who can guide and teach.
I wanted to ask you when you were talking um, about that you were talking about all these different factors, right? And you mentioned several times things that we put on our body or into our body. And I, again, with some of that research I was doing, I was really surprised at some of the things that you don't really think about, just going through our everyday life. Um, what are some of those things that we need to watch out for? And then after that, maybe well, we'll get into that later, I guess, but how do we actually, like you were saying, you need to know yourself and what's normal for you and what feels normal. But I know, I mean, I was taught check for lumps, that sort of thing, but the things you mentioned are well past just lumps. You're talking about like texture and nodes and things like that. Um, but yeah, first, could you just tell us what are some of the things that we should watch out for and maybe change to prevent those extra hormones coming into our body?
The first thing first is to know what is normal for every person. To define normal, let me give you an example, an idea that what should be checked on a regular basis. It is not just about checking on a monthly basis to find any lump.
Okay.
That thing is a story of the past, in my opinion.
Okay.
Now, on a regular basis, either daily or alternate day or once a week, the visual inspection is one of the most thing that every female should do, and it should involve on a daily basis going to the changing room or shower, just to look at both sides, both breast nipples. The breast gland starts right under the clavicle bone till the last part of the breast that is felt. from the central bone, the sternum, till the armpit area. It all
That's a really
comprises
large
of the,
area. That's a really
yes,
large area to check.
yes, it is a large area to check, but this should be included in the examination. That's the
Okay.
thing, that we are not properly guiding and teaching our younger generation about this thing, and it should start right from their teenage, when they start to develop their breasts, after the age of 9-10 years, or later, or a bit earlier, any age group that is particular to that person.
Mhm.
They should be taught that they should, on a regular basis, check if there is any skin change, if there is any pigmentation, if there is any scar, any mark, any redness, if there is any increasing difference between both breast or nipples. Ideally, there can be a small difference, small variation in both sides, that is normal. But if there is increasing variation, it should be considered. If there is any, you can say, pigmentation that was not there couple of days ago when she checked, if it appears near the nipple or areola or any part of the breast or the chest, then she should keep a note of it and keep checking. If that pigmentation increase in number, in its size, or its, you can say, the color is changing, then it should be considered. These all are not a sign of cancer. These all are part of the normal awareness thing, that should be aware that there is something going on. It can be a normal thing, it can be a normal variation for her, but it can be a sign that can lead to any problem in the future, after a month, a year, or 5 years. But it should be under her consideration that she has to look for all these things. Secondly, she should check for any kind of discharge from the nipple. Nipple discharge can happen in the teenage, in the 20s, even without any pregnancy, even without breastfeeding. Nipple discharge can happen. If there is discharge, she should note if it has color or it is colorless, if there is any kind of stickiness to it, any kind of rash with it, any itching with it. So all these things have to be considered. Let's suppose a girl of 15 or 16 years of age, she notices that there is a small rash near the nipple area or the areola. There is a small spot of discharge on the fabric, any fabric that she is wearing. So she should be considering the fact that it can be due to any kind of irritation, any allergy, or due to that bra or any fabric that she is wearing, due to the rub, it can cause skin damage. So if this process continues without, even she is caring for it, she changed that fabric and all that, she applied the cream, even if it is not disappearing, this rash is increasing, it can be a sign of any allergy, any sensitivity reaction, it can be a sign of infection. So the main thing is to look for any change that is happening in the skin. Now this is one aspect, is the skin. This examination can be done on daily basis. It just take 1 minute of her, just to look for, if anything is okay, that is good. She can repeat this after 2 days, 3 days, 5 days. It is a gradual process, a daily process of knowing her own body. It doesn't involve any other person, it doesn't involve any talking to any person, or gossiping about anything or anything else. It is just about knowing her own body. She only has to visit or ask a doctor or any healthcare professional if she is not able to comprehend any change which is happening to her body, only at that time. And in this process of awareness, of knowing, her mother, her elder sister, or any elder person who she asks, it is responsibility of that person not to shut her up, not to give her a sign that you are asking too many questions, you are asking irrelevant questions. She should be taught, she should be guided that in your age, if these changes are happening, these are normal. You should consider that these changes may increase in number, these changes may increase in their intensity. If she is feeling pain, you should not tell her that it is something that will happen to you, you should ignore it. Just tell her that these are part of the process of the growth, due to under the influence of hormones and anything you are eating, and also the self-care you are doing to yourself, the kind of fabric you wear, the kind of bra you wear. Maybe you are wearing an inappropriate size or inappropriate type bra which is not suitable for you. So all these information, all these things, they have to be guided and provided to every person who is undergoing these process. And after she has completed the growth process in her late teens and 20s, then the process of awareness regarding the risk factors which contribute towards the disease, they should start in daily life on a daily basis or regular basis. She should start to learn her own, and there should be a system, any health advisory system in place in everywhere, that she should either consult online or she should be able to read about it if she wants to. And if she is concerned about any change, any problem, then she can visit a doctor who is dedicated to guide and advise about these all processes. So this is the whole thing that I propose and advise and guide to every person who seeks guidance from me.
That was brilliant. I wonder if you have any suggestions about talking with young girls who are still growing into their body and not comfortable talking about these sort of things, as a lot of women and mothers want to know, how do we talk to our daughters about that when they don't even want to talk about bras in the first place or something like that.
Actually, the thing is, we have to first normalize the concept of awareness, body awareness and breast awareness in particular. That it is like learning anything that kids are into technology, the techs, the gadgets and all that. They are into learning about its different features, its different qualities, and the particular aspect that is unique to it. In the same way, we should encourage them to learn about the whole life process, the whole body process, and their own body. We should normalize the concept of learning and education, because if we are providing them the resource that are relevant and particular to their age group and their understanding, then they will feel it interesting to learn. If we are bombarding them with the information that is not relevant to their age group, then they will feel irritated with this all information. That if we
Yeah.
start telling them that there is a risk of cancer in your 40s, it is not relevant to their age group in the teens. You have to first tell them that this uh, this process of growth, it involves the increase the number and size of the glands and the cells that are present in every female. In some there is more number and size, in some there is less. In some the breast growth can be more, in some it can be less, the same age group. It all depends on the things you eat, the kind of lifestyle you have, the sleep pattern you have, the genetics you have, and all the self-care you provide to yourself. So if we put this thing in this manner, that you are providing the kind of diet to yourself, because it will help promote the growth of your body, including your breast. It will promote the growth of your bones, your hair, nails, skin texture. They are all interlinked. So if you are caring for your skin, if you are conscious about having a good skin, if you're conscious about your height, if you're conscious about your skin texture and all that, your personality, then breast growth is part of the body that adds to the personality, to your female gender identity and all that. So you should consider all these aspects, not just that it is for any kind of appeal to any person. They are all aspects of yourself that you should consider for your own health, your own benefit, for own self-confidence. They are part of your personality. You should not consider any other person while you're caring for yourself. So this whole concept should start right from the time of 9 to 10 years, when the breast development starts. In a gradual manner, one by one, we can provide them with the information that is relevant to their age group, so that they don't feel burdened about it, or they don't feel irritated about it at the time when there is some extra change that is happening in their mid-teens, because there will be acne, there will be skin change and all that. They will be irritated if they are not aware of this whole process in their early teens. So it should be gradual. It should be the thing that is easy to understand, relatable, and so that they are comfortable talking to that person who was their initial teacher, either mother, elder sister, or any person. So she should be comfortable with at least one person in this world with whom she can ask and discuss all these aspects.
And that's, I think what you're saying is to treat it, well, not only did you say like to treat it as part of the normal body, but I like what you talked about as well, that it doesn't have to be one big discussion. It's just part of life, just how we talk about growth. It's not like you
Definitely.
have to sit her down for a talk, you know.
It should be like if you are providing her some kind of a new body soap, body wash, or any detergent or anything for the fabric and all that. It should be like a normal discussion, that as we guide our children, that this is a new shampoo for you, this is a new toothpaste for you or toothbrush for you, it helps you clean the your teeth effectively. Same thing, the same tone, in the same conversation manner, where without having them to actually think about it specifically, you can just tell her that you should care for your skin, particularly those areas which are sensitive, which are vulnerable to any damage. And if that person asks you, if the kids or the teenager asks you which are those areas or which areas you are talking particularly about, you can just say that don't wear any kind of fabric that has a rough texture, that it can damage the skin of the nipple or the breast, as it is a sensitive skin area. Just in the normal conversation, you are providing her a life lesson that she should not be wearing any kind of fabric that is irritant to the skin. In the same way, a small step, daily tip or weekly or monthly tip, it goes a long way, that she should be aware of the things that can damage her skin, her body, her health. So it should not be, you can say, imposed information. It should be a part of the conversation, normal tone conversation in any adult and the child, that it should not involve any kind of particular attention by the person. It should be part of the normal routine.
I think that's brilliant. It's a brilliant approach. I try to do that with my kids. Just like it's part of life. This is how things work. Um, I just don't see the sense in dramatizing things. So just approaching it from what it is. It's a regular everyday part of life. But that's really,
Definitely.
it makes sense. But what I wanted to ask next is what you were talking about with those shampoos or soaps or things like that. I know apparently there are a lot of products we use that have things in there that are carcinogenous or increase the risk to whatever extent, I don't know, but I was hoping you could tell us more about that.
Yes, definitely. There are some chemicals that are included in the plastics. Some good quality plastic, they have a label that BPA free. So these BPAs, these chemicals, they have estrogen-like effect in the body.
And
If
sorry,
the
what does
person,
BPA stand for? Do you remember?
those,
I don't.
this bisphenols and all that,
Okay,
there's a whole name for it, but I should not, I should read it again to
that's okay. I'm
memorize
sure
it.
it's a long
But
scientific name.
okay. So the BPAs, they are present in the plastics. So any container in which she is drinking or any person is drinking, not just the female, any male person, any person, because it has, it is not good to have those low quality plastics which have BPAs, as they
Okay.
are carcinogens. Things should not be heated in them. No hot beverage or hot stuff should be in those plastic bottles or containers. Same is with those skincare products which have parabens in them. These
Okay.
also have a tendency, estrogen-like tendency, because when absorbed in the body, they will act as external estrogen in the body, and they will have same effect like the estrogen inside the body. So same is like heavy metals like aluminum in different skincare products. And in the pesticides, there are chemicals which are sprayed on different, you can say, vegetables and fruits and all that. So excessive use of these pesticides, this is harmful. So there are loads of chemicals, loads of things. And one particular thing that I want to highlight at this moment, that bra selection is vital, not just for the breast care, but also as it has dyes which has chemicals which are carcinogens.
Oh, right.
those bras which are heavily dyed and dyed with those chemicals which are carcinogens, which are not of good quality, they have a tendency to be absorbed in the skin, and they will definitely affect the skin texture, they will definitely affect the cells, and it has tendency to increase the risk of cancer also if those chemicals are absorbed on a regular basis, particularly if that person is wearing over a longer period of time those bras which are heavily dyed, which are treated with those chemicals which are carcinogens.
So
So it
how
is
would you
one
find
thing,
out if your bra has that?
any bra which is dyed with lots of you can say heavy colors or deep colors, or those textured bras that are available of any company or any brand that is lesser known, that has a source which is not known, so it should be a warning sign
Okay.
that
Okay.
uh, a simple bra, especially natural fabric bra, or you can say partly synthetic, those are all right. But anything that is of those colors which are very, you can say, bright colors, very attractive, just to make them attractive and all that, they definitely have those chemicals which were used to dye them again and again, just to give them that kind of look and that kind of texture. So it should be avoided.
I'm just surprised. It seems like most laws try to outlaw things that are carcinogens, and so I'm just surprised that that's so commonly found.
Actually, there are two things. One aspect is of the consumer, one aspect is of a normal person who is trying to use these things. The other aspect is the corporate factor. That involves the sales, that involves the
Yeah.
promotion, that involves the added benefit tag, that if you do this, you will get this benefit. Whether this benefit is organic or it has all the strings attached to it. So we should be caring and considering the part that we have as a consumer, as a user, as someone who is trying to adopt these things or changes or all that. So
Yeah.
to make ourselves safe, we have to consider all these aspects and make wiser choices. We cannot be wise all the time, but at least we can try to be wiser.
Yeah, I think that goes back again to that taking care of your own health as much as you can, you know,
Definitely.
watching out for those sort of things. I mean, is there a bra brand in particular that you know doesn't use those dangerous or more cancer-inducing things?
We should not be concerned about the brand. This is one more thing that people mostly they highlight that this particular brand is very good.
Okay.
That brand or that thing would be good. It would be a really good brand with a lot good care while treating the fabric and all that. But it doesn't mean that it should be a proper fit to that person. If it
Okay.
is not providing a proper fit, if it is not providing the proper, uh, there are three main things any bra should do for any female. It
Okay.
should provide proper support, it should be proper fit, it should provide proper support. The second is it should not impair the circulation and drainage of the ducts in the glands and the lymphatics. It should not be impairing that. And the third
And
thing
sorry,
is
the lymphatics, are those throughout the whole breast area? I know there's a bunch under the arm.
the lymphatic system is basically present in most part of the body. It is basically collecting the you can say it is a protective thing, this system.
Okay.
It tries to you can say remove the chemicals, remove the toxins, remove the
Yep.
cells, dead cells and all that. So these lymph nodes, they are present mostly in the armpit area, some in the breast glands, and some of them over
Okay.
and under the clavicle. So they are all connected through the channels which are present inside the breast, and through those
Yep.
channels this lymph is flowing against the gravity towards the armpit area. So if
So if
any
you've
bra
got
that
a
is,
really tight bra, it won't drain properly?
if the bra is tight, it will not drain or not properly drain. And if the bra is loose, if it is not providing the proper support, then due to the effect of the gravity, it will be hard for those blood vessels and those lymph glands to properly move against the gravity. It should be
Oh,
proper
wow.
fit.
I had no idea
Those
that
are
the bra did that benefit, that actual medical benefit.
the, the basic benefit is to provide support, and the added benefit comes from the movement of the shoulder, of the arm and the chest area, because whenever we are moving our arms and the chest, due to the movement effect, it helps support the proper circulation and drainage. But if a person, if any student or any person who is working from home or in the office, or any person who is sitting for 6 to 8 hours in the chair in any work environment, so definitely, if the posture is incorrect, if the movement of the arms and the chest is less, or it is very reduced, then definitely it will affect the lymphatic and the normal drainage of those ducts and the glands also. Because I often give example that if a person is in a habit of sitting leaning forward like this, leaning forward, and if she is not wearing a proper fit bra, if it is either loose or tight, so she is providing two factors that are against the breast health. One is due to the effect of the gravity, all the secretions will be pulling inside towards the downward area. If the bra is constricting, or if it is loose one, both will not provide proper support to the breast. And due to the effect of the posture, these glands are constantly flooded with all those secretions and all those lymphatics and all that. So she is not allowing her own breast health, breast glands to properly function. And if this process goes on for months, years, then definitely there will be some kind of damage to the glands and the ducts. I'm not saying it will cause cancer. I'm just saying it will cause an increased risk of inflammation. Any inflammation inside the breast or any part of the body, if it continues, it leads to the formation of damaged cells.
Yep.
And damaged cells we have already covered what they can do to the body.
So I had my chiropractor once tell me that you should get up like every 20 minutes or so, just stand up from your desk if you're working in an office job or you're working where you're sitting down a lot. Is that what you recommend? Or I mean, how would you counteract this lack of movement that leads to the pooling?
She can do simple exercises while even if she is sitting. If you are sitting like at this moment, there are
Mm-hmm.
a couple of exercises that you can do right now just to
Okay.
facilitate this. One is the combing movement like this. Do this 10 to
Combing.
20 times.
Okay. Oh,
Yes,
like
just
combing. Oh, just
combing.
to lift your arm and let this drain.
Yes, it will help
Oh,
to
okay.
facilitate the movement. This is a simple
Mhm.
thing any female can do in any setting. Okay, so this is not a hard thing to do.
So you can just
Even
comb
if
your hair while you're at the while you're at the desk.
uh, you can
Okay.
do it, it's the same movement without combing. You can just do this movement, repeat this movement. The other
Right.
thing is like the flapping movement, like moving up and down,
Okay.
simple this movement, or she can do it
And down.
in the curl and all this thing. It
Okay.
helps to strengthen the muscles of the neck also, of this area, the shoulder girdle and the chest. So it is just to facilitate the movement, just to facilitate the drainage and also strengthen the muscles. Any female in the 20s and 30s, if she is in a habit of doing these things, it will help to strengthen the muscles of the chest, of the back, of the neck, and it will avoid all the unnecessary burden and unnecessary pains and discomfort due to increased work, increased sitting time and all that. So these are small steps that can help any person regain the strength of the muscles even without having going to join the gym and all that.
So how often would you suggest they do this arm movement to keep the flow going?
Anything that is suitable or comfortable for any person. She can
Okay.
start from one time and repeat it 5 to 10 or 20 times, whatever suits us. Anything, it all depends on us how much comfortable we are doing anything,
Okay.
whether one time or 10 time or 20 time. So it is all
Okay.
dependent on the person who is trying any kind of exercise or work routine or anything like that.
But at least once is better than not doing it and just sitting for months or years without without moving
Definitely,
during it.
it all depends on the person how much they are willing to adopt and improve themselves. So it all depends on them. Any
Okay.
person who wants to increase their own, you can say, health and anything, the strength of the muscles, and even if it is not directly causing them benefit to reduce the risk of breast cancer. It is just providing them something that they are doing to themselves that will help in their health, not just for cancer. There are a lot more things besides cancer that
Right.
any person can do good to their body.
Yeah.
So it is one step towards this.
I think we're going to have to do two interviews, to be honest, because we're probably about a quarter of the way through everything I wanted to ask you about. But you said the bra does three things, and we got through the first two, the support, and then what were the other two that you were talking about? I'm trying to remember. I'm sorry,
The
I'm
one
so
thing
caught
is,
up in all the things we've
okay,
talked about.
the one thing is support. The second
Support,
thing is to allow proper circulation and drainage. And the
circulation,
third
drainage.
thing
That's
is, any person who is doing any kind of physical activity, any kind of exercise and all that, the sports bra she is wearing or she is selecting, she
oh my
should do it
goodness.
after the proper bounce test.
Okay, so this is actually perfect because I am actively on the hunt for a good sports bra right now. What do I look for?
The only thing that you should look for is that it should not be a lot constricting. Sports bras are supposed to be those which are providing proper support, all part of the breast, but there are some bra types that may or may not be suitable for you. Because
Okay,
like for instance, if you are you have to check whether it is a good fit or it has a good bounce test or not. You just wear it in the proper way that you feel comfortable with.
so
When
what's
you're
your
comfortable,
definition of a good bounce test?
a good bounce test. Let's suppose you are wearing a bra that you feel it is comfortable, it is suitable for you. You just have to bounce or skip 2-3 times. If you feel that there is an additional jerk to the breast, if there is discomfort during that thing, if you
Okay,
feel, if you are viewing in the mirror, if you feel that the breast is not properly supported during a jump, when you are
okay,
going up and when you are landing on your feet, if there is additional jerk, if the breast tissue is not properly supported, even it fits good, it feels good, it is not a good bra for you, because
okay,
it is not allowing breast to properly get secured, and it is giving the same kind of jerk that was present in any other bra. So this is the thing to avoid, because it will not do any harm at that moment, but it will harm in two ways. One, it will damage the inner you can say muscles and those adhesions which are present inside the breast tissue. Those are called ligaments, the Cooper's ligaments. They are there to hold the breast gland and the ducts all inside. So if those ligaments are damaged, then it will cause sagging. So this aspect has to be cared. And the second thing is, due to any jerk, we are constantly pressing the breast towards the chest wall and towards the bra that any person is wearing. So due to this effect, the constant rub, the constant friction and the constant pressure, there can be skin damage, particularly to the nipples. It can cause nipple abrasion, nipple skin damage, and it can lead to cracks and infection in the nipples.
okay.
So the proper fit, proper support, and the third thing, it should not be having an awkward bounce or an awkward jerk to the breast or skin and all that. So these things have to be considered.
Oh, that's brilliant. Okay. So, I mean, do people go too far in the other direction where they get a sports bra that is too small or is compressing them too much?
They, of course, exercise activity is for a limited time, for 20,
Right.
30 minutes or 40 minutes. So if a person is wearing that kind of bra, if she is into a strenuous exercise routine, so she can wear a bra that is a bit constricting, a bit tighter one,
Yeah.
to avoid skin rub, skin damage, and also to avoid the additional jerk and all that. So for that period of time, she can wear it, but after that, after removing that bra, there should be some massage, breast massage and lymphatic massage
Oh, really?
afterwards, because breast massage is very important. People
I have
don't
no idea
consider
about
this.
this massage. I have no idea how it
There
works.
Uh, there are different kind of massages depending on the size, on the age, and the purpose of the massage. Because in any person, any healthy female in the 20s, 30s, or 40s, if she is not lactating, if she is not pregnant, and all that, a normal healthy person, a simple massage of 2-3 minutes on a daily basis, just to improve the circulation and drainage of the breast. It
Okay.
allows the normal drainage of the lymphatics. Also, it provides a good skin, you can say, added benefit to the skin with the kind of oil or any lotion that is sensitive for the sensitive skin, to provide proper moisturization, to avoid dryness. So these all benefits go a long way. And also it helps in skin strengthening, to avoid unnecessary breast sagging, unnecessary skin changes, unnecessary or early wrinkles and stretch marks and all that. So all
Yeah.
these aspects are covered with a simple 2, 3, or 5 minutes routine of breast massage on a regular basis, whether after exercise or before sleep. It has a very good beneficial effect on breast health.
So is that with like a lotion that doesn't have BPA's or olive oil or coconut oil or just anything so you're not just rubbing the skin and irritating the skin?
Olive oil is good, coconut oil is good. They have skin benefits. Same as with almond oil. So
Okay.
anything that is available which is not irritant to the skin, anything
Okay.
that is available to any person, they can use it. So it is just to provide the you can say skin nutrition and skin support, that it is not dried. Because due to any you can say soap used or any skin or body wash used, it has a tendency to wipe off the normal oily layer of the skin,
Yeah.
just to make it feel clean. To make it clean, it removes all the oily, the protective layer of the skin. So we have to provide it with some kind of skin barrier, with the use of natural oils and all that, just to keep it healthy, glowing, and to reduce the any kind of skin damage. So it is for any person who is in a regular routine of self-care.
So after you work out, you massage for a few minutes with some sort of oil to drain the lymph area.
Lymph is mostly drained whenever you exercise, it is drained.
Yeah.
But it is just to give a clue that massage will help to reduce the discomfort due to
Okay.
any use of any constricting bra. Even if a
Yeah.
person is wearing a constricting bra, not just for the exercise, for any outdoor activity or anything like that, for a couple of hours, if that is well, after that, to relax the muscles, to relax the glands, and to relax the skin, a small massage will have an added benefit.
I wonder if that's what's happening. I know, as a man, you don't wear bras, but as a woman, at the end of the day, one of the best feelings is taking off your bra. I wonder if it's because now you're suddenly like getting that circulation and getting that, um, I, I don't know, just everything moving a bit better.
uh, After removing the bra, actually it is if a person, if a female is not wearing any kind of bra after a whole day of activity, then she is allowing all those secretions to pull in again. So
Yeah.
she should be wearing any kind of support bra, any t-shirt or anything like that, that
Yeah.
should at least provide some kind of support,
Yeah.
so that there is not total, you can say, after one extreme you go to the other extreme. It
No,
should
no, I mean, like, just at the end of the day, to
uh,
when you get your bra off, it
hmm.
feels nice to be, um, unrestricted, you know?
At that time, after that the phase before sleep or anything, whenever you are relaxed, couple of minutes of massage will add to that benefit. I'm
Okay.
just telling that it will help.
Okay. That's good to know. I had no idea. Brilliant. So we've gone through the benefits and types of bras and how to find one that fits you well and how to test for that, how to use them during exercise and what to do after. Um, that's a lot. I didn't know any of that. You've just educated me very much. Thank you. I wanted to ask as well though, when a woman is doing that massage, is that a good time to do the check as well? You were talking about visually and to check the whole, it always sounds like the whole pectoral area, really. that you want to go
Yes,
over?
definitely. If she is in a habit of regular massage or skin care, she can check it at that time. Because if after applying any kind of oil or lotion, it makes it easier to palpate. It makes it easier for the movement. Because uh, this is one more thing that I regularly educate, that it is not just about the circular movement that is advertised everywhere, that you just do this round circular way all around the breast just to check. Uh, it is not a complete way of checking for the lumps or anything like that. Because
Okay.
in this circular movement, small lumps or anything that is present between the ducts or along the side of the ducts or along the ducts, it can be missed. Because the ducts are,
Okay.
this is a central point, the nipple area. Ducts are going away from it, like fanning out. So
Yeah.
if we are checking like this, we may be missing some small lumps or anything like that. So it should be checked in the circular manner, in the line way, up and down, and outwards in the 1 o'clock, 2 o'clock, 3 o'clock, like this.
Oh,
Because
really?
in only in this way we can check if something is circular or tubular. Because if we are checking like this, we will not have an idea whether this is a round structure or tube. We can only check if it is a tube if we are running our fingers in its direction,
So you'll do the circular, then you'll also do vertical, and then also fanning out.
fanning out. Because
Oh,
the ducts are fanning out, ducts
right.
are like this. So
Yeah.
if we are checking in this manner, only then we know whether if a particular duct is dilated, if it's blocked or clogged. Only we can trace it like this. If we are going like this, we are only checking the part of it. Same like
Right.
if there's a bunch of straws. If we look at this, these are 5 round structures, from 5 hollow structures. If we
Right.
are doing like this, these are 5 straws. So this is the whole concept, that we have to look for the changes, not just the lump. We have to look the texture, either it is spongy, either it is grainy, either it is nodular, either one part feels more denser than the other, either one part feels hard than the rest of it. So we have to look for the texture and all these things. And it can
So,
only be felt.
sorry, finish. Go ahead.
Okay, so we have to look at the whole picture, not just for the lump. We have to notice the changes also. Like one
Mhm.
day, if she feels that one part of the breast, it feels harder than the other, it feels nodular.
Mhm.
And after a couple of days, if she is checking it, it feels that all of the breast tissue is same spongy one. It means there was some factor that were causing congestion in that part of the breast gland and the ducts, which she was feeling at that moment, but later it got reduced. So she has to be aware what is normal for her. She can only be aware if that it is normal if she is in a habit of checking on a regular basis. If she is not in a habit of checking on a regular basis, then anything will feel like a cancer to her.
Oh
Any
gosh.
change will feel like if it is a cancer.
Right.
So this is the whole concept, that you have to be aware, and this awareness should start from the time that you started to develop your breast in the teenage, and after that only then you can know what is normal for your own body over the period of time, over the period of years.
I wanted to ask, when people hear nodular, they might be a little bit confused about what exactly you mean by that. Could you explain how you would tell if something is nodular by palpating by the feeling?
uh, like if any person, like example of a bean bag, there are small beans in that. If you are rubbing a finger on a bean bag, you will feel there are small nodules and small lumps inside it, but it will be homogeneous, it will be same all over it. The
Yep.
same thing is with the breast. If a breast gland is congested, either she is lactating, either she is pregnant, or either she is having any kind of hormonal change that is making those glands and ducts have more activity in them, more secretions pouring inside. It happens to every female
Yep.
a couple of days or few days in the menstrual cycle, that breasts feel tender, they feel more heavier, they feel more firmer. So it is part of the normal congestion that happens with the hormonal change. If she is feeling that all the breast tissue, all the breast gland feels the same way, the same nodulars, the same granular, like a bean bag, if she is feeling, then it is normal for her. But if a certain part of the breast is like this and the rest is spongy, it is
Okay.
squeezable, and that part is, if she squeezes it or she tries to squeeze it, it is tender, it is painful. It means that particular area has something going on which is against the other, the normal part of the breast. She should consider it at that moment. She should repeat it just the next day, couple of days later. If that thing persists, then she can visit a doctor that I am feeling
Okay.
something strange in that particular area. If that congested area, if that nodular area resolves in a couple of days, then it is normal thing.
Okay. Yeah, that makes sense. I know what you mean about that feeling of the beanbag feeling. I didn't know if that was called a nodular or not. But that's, yeah, that's really, really helpful actually. I'm sure a lot of people right now are gonna be thinking, "Oh, I better go check that." And also, just the idea of checking on a regular basis so frequently. I didn't realize it was something to be done so frequently.
Skin can be checked on a daily basis. If whenever she is changing, whenever she is in shower, she can then check on a daily basis. It just take 1 minute, just a look, just to check if everything is the same way, same as every person checks the face or any pimple or any mark or any mole or anything like that. The same thing is checking the both side of the breast and lifting the arm and checking the armpit. That's the thing. The,
That's right.
the physical examination, the palpation, it should be done on a monthly basis. If she feels something different or something weird, she can check it on the next day or couple of days later. But the visual inspection can be done on a daily basis, and the palpation on a monthly basis. That should be part of the routine. She can have
Okay.
an additional checking if she feels something different. Otherwise, it should be done like this.
All right. Well, I'm gonna have to make sure I do that going forward and teach my kids about that as well so that they make sure that they're they're following your advice because it's really good advice. I wanted to ask as well, and just kind of shift a little bit into risk factors because I know there are different um, things we've talked about so far in the environment that affect the increase in and too much estrogen, and that can lead to an increase in breast cancer risk. What are some of the risk factors, generally speaking, for aside from the situational risk factors? What are some of the ones for um, lifestyle, genetics, diet, all of this?
There are basically two kind of risk factors. One is the modifiable one that anybody has control of. The second is non-modifiable. Being a female is a non-modifiable risk factor. Female
Okay.
are at more risk. Men do have a risk factor, but very less. So the second is having gene mutation, BRCA1 and BRCA2. If they have this gene mutation in their body, they are have an additional risk. Same as having a family history of any blood relative, mother, sister, cousin, or aunt, or like that, or grandmother.
Okay.
So these are the non-modifiable risk factors. Same as if a person, if a girl gets the menstrual cycle before the age of 12 years, it adds to the risk factor.
Okay.
Not particularly that it will cause breast cancer or it will have a definite risk factor, because it is an indication that there is increased estrogen in the body from the early years. So if she gets married and have or gets pregnancy and she lactates in her mid 20s or late 20s, then this risk factor reduces because she has limited the estrogen level in her body. So as many times she gets pregnant, she lactates, or she has reduced this break in the estrogen cycle or this estrogen surge, it adds to the benefit towards breast health. So same goes if she hits the menopause after the age of 50 years or 50 years, then this also prolongs the estrogen stay in the body. So all these factors, they are non-modifiable one that one doesn't have a direct control over. The modifiable ones are the diet she takes, about the contraceptive pills. If she is taking, she can avoid those. The external estrogens that I have discussed, if she limits their use, if she limits unnecessary relation to exposure, like going having x-rays or mammograms, so reducing those before the age of 40 years It is a modifiable risk factor. So all these factors, they contribute either towards breast health or towards increasing risk of breast cancer. And the main thing, that is to control the estrogen in the body and to limit the amount of stuff that we are using over the body or inside our body that adds to this estrogen surge or estrogen levels. So all these things, they are modifiable, that we can try to reduce as much as possible.
One thing I read was that it was interesting, and you can tell me what you think of this, if it's accurate or not. I think it was from, let me double check my source here. Um, it's breastcanceruk.org, and they mentioned that interestingly enough, people have asked if being overweight is a risk factor, and apparently being overweight when you reach menopause is a risk factor, but being overweight before menopause is not. I'm not sure what you think of that.
Actually, any person who has additional fats on the body, any person,
Okay.
having additional fat means there is an imbalance between the calories consumed and the calories burnt. This is a very simplified thing of this. So anything that is stored in the body in the form of fats, the these fats, they are, you can say, a direct source of estrogen also. Also
Okay.
these chemicals that act as estrogen, they are also stored and deposited in additional fats. So they are a constant storage house of estrogen and estrogen like chemicals, which are causing some kind of damage towards the body and also to the breast, because they are promoting more fatty deposition, they are promoting more estrogen like effects in the body. And if a person, if she has a menopause, let's suppose at the age of 50 years, she has a store of those fats and those chemicals in the body, they are an external source of estrogen. Even her internal source is depleted, is estrogen. The external source is constantly acting in the body and in the breast glands and all that, to cause those changes which were meant to be stopped after the reduction of estrogen after menopause. So this added store of estrogen like chemicals, it is in those fats that she has developed and gathered all her life, and now these estrogen like chemicals, they are causing the damaging effect.
So she's basically stored extra estrogen in the form of fat, and that
she has stored she has stored those fats which have absorbed those chemicals which are
uh,
acting like estrogen.
okay, okay. So basically a holding place,
Yes, it's a storage house, you can say.
a storage house. There we go. So that makes me wonder then. I know a lot of women have talked about how wonderful HRT, hormone replacement therapy, after menopause or in perimenopause made them feel, and they felt like they were themselves again. And a lot of people have talked about during menopause, they just start to gain weight and all these sort of things. How does one balance all that with the changes that
Actually,
are so hard on your body
uh,
and yet not increasing the risk of breast cancer?
uh, one thing is having a good physical activity,
Okay.
because you are burning those fats that you are gathering around, so you are burning those also. The second is to eat healthy and to reduce that additional source of external estrogen. And the third thing is to limit the amount of those replacement therapy drugs, estrogen like drugs she is having, to reduce the amount as much as possible. Whatever is applicable to her health status, she can, because everybody is different, everybody has a different body to respond to these chemicals that she is trying to use just to improve her overall health, her skin and all that, energy levels and all that.
So
So
how would she talk with, because I imagine your average doctor, and I don't know who is allowed to prescribe HRT, but I imagine your average doctor doesn't have as much knowledge about breast cancer, obviously, as someone like yourself. So obviously they would need to work with their doctor to get the right balance, like you were talking about. But should they be seeing a specialist? Should they be seeing someone who can consult on this depending on whatever levels they have in their body and to make sure that it's not increasing their risk?
Actually, anything that is estrogenic or anything that is related to estrogen, it will definitely increase the risk factor. In some,
Okay.
it will increase more, in some, it will less. But any lifestyle change, any change she adopts, she has to consider both the risk factors and benefits and weigh those before initiating any kind of therapy. So it involves self-information in the form of any journals, articles, or Google, or she can ask the doctor who knows about her health condition. So it involves understanding of all the risk factors, the benefits, and then she can decide whether she is able to modify her lifestyle to reduce those risk factors that are attached with any therapy or any breast augmentation or reduction or any surgery or anything like that she adopts. So it is not just for HRT, it is also linked with any breast implant or any surgery, cosmetic surgery, that she has to be aware of the risk factors, because anything that we are inserting inside our body, even if it is water, if it is in imbalanced amount, imbalanced proportion, it will have some kind of effect. So she should be aware that she should make informed decision, not a rash decision, informed decision. So then she can justify that if something goes wrong, and she knows that it was her own choice and it is a complication or side effect of this. So
And
then
then
she
she
will be,
can sorry, she can be
at that
checking as well, right?
he will be checking as well. And secondly, if something goes wrong for that person, then at least she will know that that was a choice that she made after considering all the factors. She will not blame anybody or any person or anything for this. She will know that it is a consequence of something that she adopted on her own after considering all the risk factors, all the things attached with it. Then she will make those changes or choices or treatment choices that she feels that she can cope with, so that she can minimize those risk factors. Because it should be based on the information, not just something that everybody else is doing. It should be based on something that she adopts after knowing all the aspects.
Yep. Going into it with an analytical view as well, just to, like you were saying, look at the benefits, look at the risks. And also, is it I imagine you can try hormone replacement therapy, and if it works for you, then carry on or adjust, but it's not something you have to stick with permanently if it's not working.
Definitely, you have to monitor everything. Whenever you start something, you have to monitor it. You have to monitor the
Yep.
changes. And if it is not a perfect fit or ideal fit for you, then you should avoid it, because it should not give you any harm in a short run also. In the long run, nobody knows what will happen, but at least in the short run, it should not give you something that is damaging for you.
That's brilliant. Um, I think what we're gonna have to do is pause it there because I think we've almost got an hour and a half already, which is a bit crazy. But if you're willing to do a part two, I have a lot more questions still about other things. But we've covered a lot so far, and I just want to say
Yes,
thank
we
you.
can do, most welcome. We can do a second session, but after a couple of weeks.
Yes, fair enough. Fair enough. All right, that is brilliant. Thank you so much. Um,
Most welcome.
I'm gonna pause the recording just now and get back to you.